Hello, everyone. Hello from Washington, D.C. Hello from the Caspian Policy Center. Welcome to our webinar today on COVID-19 in the Caspian region, implications for health policy. This is a very important event for us. We have 6 deputy ministers from the Caspian region attending, and also we have our dear colleagues from CDC and our dear moderator, Ambassador Jimmy Coker. This is a very important event because the countries of the Caspian region are facing important public health challenges by the spread of the global COVID-19 pandemic. Effectively addressing these challenges requires a holistic approach and strong cooperation between the region and with global partners. The Caspian Policy Center, in coordination with the embassies of Afghanistan, Azerbaijan, Georgia, Kazakhstan, Turkey, and Uzbekistan, is bringing together high-level public health representatives as well as senior representatives of the U.S. Centers for Disease Control and Prevention and foreign policy specialists to discuss the situation in the region as well as in the globe. Specific topics will include sharing experiences and best practices in containing the pandemic, facilitating effective health policy response and opportunities, and need for bolstering regional and broader regional cooperation. I'd like to thank all of our speakers and also all of our attendees today. And also I'd like to thank our colleagues from the embassies of Afghanistan, Azerbaijan, Georgia, Kazakhstan, Turkey, and Uzbekistan, and also from CDC as well. This is our first webinar this year, and I hope this is going to be very fruitful for everyone. We were supposed to hold our 5th Trans-Caspian Forum this year, but due to pandemic situation, we had to delay this event until next year. But in the meantime, we'll be holding important events, and the first event is on the pandemic issue. And now I'd like to hand the floor and the mic actually to our dear moderator, Ambassador Jimmy Coker, and the mic is yours.
Thank you very much. I'm honored to be part of the Caspian Policy Forum, although I'm not an expert on that region. I was a U.S. ambassador, foreign service officer for many years, but ended my career from 2011 to 2017 in the U.S. Ministry of Health, the Department of Health and Human Services, as the Assistant Secretary for Global Affairs. So it's great to see health ministry colleagues on the phone as well as diplomats looking at where the two fields come together. Just as a housekeeping matter, please everyone locate the interpretation button at the bottom of your window and choose the language channel that's the best for you. The original presentations will be mostly in English, but some in Russian. So if no language channel is picked, you'll hear the original in the language it's being delivered. But if you wish to hear a translation, please select either English or Russian. You'll hear the translated audio and the original audio at a lower volume. So with that introduction, we'll be going in alphabetical order by country. And with the CDC, though, following the first speaker, who is from Afghanistan, who does have to leave for another meeting. So it's my honor first to introduce Dr. Wahid Majrou, who's the Deputy Minister for Healthcare Service Delivery, has a career in a number of management positions in Afghanistan, and as a former diplomat, I'm pleased to say he included in his career time as a locally employed staff member at the U.S. diplomatic missions in Afghanistan. He joined the Afghan Ministry of Public Health in 2015 and is now Deputy Minister for Healthcare Service Delivery. Dr. Majrou, you're on mute, so yes, thank you.
Thank you very much. It is a great honor to be among our colleagues, and a warm greetings to distinguished panelists and respected audience of this webinar, and a special thanks to the organizer of this event, the Center for Caspian Policy. It is indeed a pleasure and a privilege to represent Afghanistan at this virtual conference on COVID-19. As a fact of today, the international community, including Afghanistan, is facing the century's greatest public health threat, the COVID-19 pandemic, that recognizes no borders, has significantly disrupted the lives and overwhelmed the health systems and the government. The ongoing pandemic has presented the country with its own unique challenges. Over the past few months, more than 300,000 Afghans have returned to the country from heavily infected areas, including Iran as the epicenter of the virus in this region. and this has exacerbated the spread of the disease across the country. This has also overstretched our already constrained healthcare delivery system. Today, more than 12,000 confirmed cases and 220 deaths have already been reported through the limited surveillance we have ongoing. Containing and combating the pandemic is a key priority of the government, and we're taking necessary steps to manage the situation timely and quickly. We have upgraded our health system, imposed lockdowns and restriction on movements, and closed education institutions to cope with increasing needs linked to entry screening, health messaging, contact tracing, isolation, and case management. An additional health workforce was also rapidly deployed in major population centers such as Herat, Kandahar, and Kabul. We thank our partners who have stepped in to help us rapidly scale up response efforts, particularly in establishing essential supply lines, expanding testing capacity, surveillance, and community awareness. Being a protracted conflict for over 40 years, Afghanistan has an array of ongoing humanitarian and development crises that also requires urgent and continued attention. The impact of COVID-19 will have collateral effects on these ongoing crises, upending people's lives, increasing human sufferings, and worsening inequality. Now, the two major obstacles for combating the COVID-19 in Afghanistan is lack of cooperation for community and low testing capacity. As the level of education and health awareness at the community level is low, many community members show apathy for complying with the recommendations provided by the Ministry of Public Health of Afghanistan. We have placed our efforts to reach the communities through different approaches, including the involvement of religious leaders and community leaders. However, the effect of our intervention is still suboptimal. In addition, as Afghanistan is dependent on international assistance, we still look forward to increase our testing capacity in all Afghanistan. To meet our requirement in terms of testing capability, we look forward for receiving technical assistance to scale up our testing capacity from Caspian region. We believe that the fight against COVID-19 requires a coordinated response backed by global and regional solidarity. Extensive investment in research and development is crucial to produce an effective vaccine and treatment for COVID-19. We express our sincere gratitude to all partners who are standing by us in this difficult time for their continued technical guidance, provision of life-saving supplies and personal protective equipment, capacity building, surveillance, and support in establishing and expanding diagnostic capacity for the COVID-19 response. As we are already starting to see, unfortunately, the impacts go far beyond just health. Afghanistan will likely feel the effects on its economy, food security, and provision of social protection for years to come. Addressing these during and beyond the pandemic will be an uphill battle, difficult but not impossible if our regional and international friends continues to stand with us in solidarity. Mitigation efforts needs to happen now to minimize the repercussion for the worst and most vulnerable groups in the country, and this needs a much more comprehensive multilateral approach. At the end, I would like to reiterate that to overcome the COVID-19 pandemic and elevate the health, economic, and social impact of the COVID-19 pandemic in this country and region, we need to establish a strong regional cooperation and coordination mechanism. We should exchange our experiences, assess and increasing the technical capabilities, conduct joint researches, and provide all kinds of significant support to the governments that needs it. Thank you very much.
Thank you, Dr. Majrou, and thank you for keeping to the time that we asked for 5 minutes from each speaker. I should remind people that if you do have questions, you can include them in the Q&A or the chat, and there'll be staff from the Caspian Policy Center who will help me organize those at the end. But in the meantime, we'll let the speakers all present, and then we'll have a time for questions and discussions at the end. However, since Dr. Majrou has to leave, if there is, I haven't seen a specific question for him, but if there is one, please ask it now or raise your hand.
I will have another time, so before I leave. Thank you very much.
Thank you. The next speaker is Dan Singer, who is longtime friend and regional director for Central Asia based in Kazakhstan for the U.S. Centers for Disease Control and Prevention. Dan joined CDC in 1999, but he then has held a number of important global health positions in National Institutes of Health, the Department of State's Office of International Health and Biodefense, and in offices at HHS and CDC. Dan, pleasure to have you to talk about the situation in Central Asia as you see it.
Good morning, Ambassador, and good morning, everyone. It's a great pleasure to be with you today to talk about CDC's role in supporting the people of Central Asia in combating COVID-19. CDC opened its first office in Central Asia 25 years ago. Today, we have staff in over 50 countries worldwide, including Kazakhstan, Kyrgyzstan, Tajikistan, and Uzbekistan. We also offer assistance when requested to the Ministry of Health in Turkmenistan. Unlike other binational programs, we are not a development or assistance organization. We are a health agency staffed by epidemiologists, laboratory specialists, and other public health experts. Our purpose is to partner with ministries of health to advance health science and develop programs that prevent, detect, and respond to disease. The reason the US sees this as a worthwhile investment is now painfully obvious, because diseases, especially infectious diseases, spread globally faster than ever. Our support to this region is not just an investment in the health of those nations, it's an investment in the health of America and the whole world. Since the beginning of the COVID-19 outbreak, CDC has offered our technical expertise to governments in Central Asia. We've provided advice and collaborated with ministries of health on epidemiological analysis in areas such as hospital infection control, case tracking, hotspot analysis, and epidemic modeling. The early response of countries in the region to COVID-19, including the closing of businesses and restrictions on movement, has slowed the spread of the virus. We are now pioneering the use of public data sources that track the mobility of people to monitor the lifting of those restrictions and anticipate any resurgence of COVID-19. Recently, we announced an initial commitment of $6.8 million that CDC is providing over the next 2 years to support the Ministries of Health in Central Asia in protecting their country's citizens and conquering the pandemic. This is on top of the millions that have been allocated through USAID and other government agencies to COVID-19 response in the region. Our CDC offices in each country are now working with the Ministries of Health to finalize our plans. We are purchasing millions of dollars of supplies for national laboratories to expand their ability to test for COVID-19. We are building public health emergency operations centers and providing equipment and advanced training to monitor the health of people arriving at borders and ports of entry. The trainings we are providing and the collaboration in COVID surveillance and epidemiology is built on the Central Asia Field Epidemiology and Training Program, of which we're very proud. This CDC program provides advanced skills in applied public health to specialists who already work for the Ministry of Health. Since 2003, more than 115 Central Asian nationals have graduated from this program and gone on to lead outbreak investigations and take public health leadership roles in their countries. Their training and our long-standing partnerships in emerging infections, HIV surveillance, and laboratory science are being leveraged to monitor the spread of COVID-19 and devise more effective response measures. We know this will be a long fight, and we are preparing an additional request for funding from our headquarters to be able to expand our support to, in addition to the funds that have already been committed. We're at a rare moment in history when the attention of the world turns to a health challenge. All countries, including the United States, are now struggling to minimize the impact of the virus while also trying to minimize the impact on their economies. As we move forward, it's more important than ever that we work in solidarity, sharing information, supporting each other, and working under the principles of global health security to make science-based decisions that will help us defeat this disease with the minimum loss of human lives. CDC has had productive collaborations with these countries for many years, and the CDC office in Central Asia, our headquarters in Atlanta, and all of our country offices stand ready to expand these partnerships to address this new threat. Thank you.
Thank you, Dan, and thanks for the work that you're doing in Central Asian region on behalf of all of our governments. Also from CDC, we have Dr. Mitchell Wolf, who's the Chief Medical Officer based in Washington, but who's been working on establishing the regional office for the Caucasus region for CDC, and Charles Vitek, who's now working on the coronavirus task force at the White House, but has long experience as the CDC representative both in Russia and in the Ukraine. And I'd be interested in, Mitch is going to present, but then I'll turn to Chuck for 1 minute's comments after the presentation from Mitch Wolf. He worked as my deputy for 3 years, and I can say that he's been a remarkable public health champion and guide in overseas tours in Asia and also in Washington for the last 6 years. Dr. Wolf.
Thank you very much, Jimmy. Can you hear me okay?
Yes.
Okay, thank you. In my time allotted, I wanted to talk a little bit about the US domestic coronavirus response, and then also about our global mission and mission in the region, and then we'll be happy to take questions later. So just briefly to talk about our US response, we have a whole of government approach to get and keep America open. And as of May 26th, there have been 1.662 million confirmed and probable cases in the US and 98,261 deaths. CDC is focused on publishing the latest data on the web, on providing guidance for mitigating the outbreak in the US and in globally, and on working on getting and staying open. And one of our primary goals right now is to cooperate closely with communities across the US as they consider approaches to mitigate and contain COVID-19 in preparation for opening. We have many decision tools for reopening, and many of these are on the web, and I do encourage people to look on the web, and we're also happy to provide those links for people who need them. Across the US, states and localities are in different stages of the pandemic, and we're trying to help these communities understand where they are and make decisions based on where they are and where they want to go. One of the things we focus on is surveillance and testing, and I'll talk about each of those for just a minute. We rely on a combination of data sources for our surveillance strategy. That includes adapting our existing respiratory and influenza surveillance systems for coronavirus, case reporting, commercial laboratory reporting, syndromic surveillance, ongoing research platforms that are specifically geared to coronavirus, and developing new systems to answer specific questions as they arise, and to look for specific diseases and syndromes that are associated with coronavirus, for example, in children recently. We need to keep the whole system in mind and look at how the pandemic is affecting the health system and what the ripple effects are and how to try to mitigate some of those effects. Addressing in COVID-19 has really been a lesson in the connectedness of countries and the globe. And I think that we will use this opportunity to try to strengthen our global health programs. Our leadership around the world is now recognizing even more the connectedness of the world and health threats, and that diseases know no borders, and that a disease anywhere is a disease threat everywhere. And as Dan mentioned, Dr. Singer mentioned, we have staff in over 60 countries, including in the region that we're talking about now. We focus on technical assistance and technical collaborations, and it really is a two-way street where we learn and countries learn, and we can build up capacity together to prevent, detect, and respond to infectious disease threats. Coronavirus is providing us an opportunity to look for areas where we can strengthen those collaborations more. And we want to work with other countries to identify areas that we can work more for situational analysis, for increasing capacity to detect and respond, for COVID-19 transmission, but also for other infectious disease threats, for supporting critical needs of healthcare facilities and healthcare workers and public health personnel, for prevention and protective interventions, for ensuring preparedness and readiness to implement vaccines and therapeutics when they're available, to address One Health aspects of disease, including coronavirus, really being able to leverage global health expertise around the world. And one of the things that we're doing, and Ambassador Kolker mentioned, is CDC is working to develop a more sustainable, permanent overseas footprint and footprint that for where we can achieve our mission of working with countries to strengthen capacity to detect and respond to diseases. So we are starting with 4 regional offices, and one of them is for Eastern Europe and Central Asia, based in Tbilisi, Georgia. And we're just starting this office, and we're going to be looking for additional opportunities for collaboration. And that's one of the reasons I'm very excited to be here with this group, is that we will be working with Ministries of Health in the region to look for opportunities for collaboration. And our regional director in Tbilisi that we've hired is Dr. Chuck Vitek, who's here on the phone now, and we'll give him the opportunity to say a few words. And he will be moving to Tbilisi. We don't know exactly when, but as the situation allows, in the near future, to help stand up that regional office. So thank you. Happy to answer any questions, and I will pass it on to Dr. Vitek.
Thank you, Mitch, and thank you, Dan. Yeah, I'm just going to add a few words. I'm here in 2 capacities today. One is as the incoming regional director for the office that Mitch has described, where we hope to add an extra level of resources and coordination to really advance every country's effort to improve biosecurity, and to help, as Dan said, to limit the impact of these infectious diseases that are transnational threats. I've had a chance to work in almost every country of the region that's represented on the webinar today, as well as my long-term postings in Russia and the Ukraine. And at the opening of the CDC bilateral office in Kazakhstan 25 years ago, I was actually present that day to help Terry Chorba open the office. The second capacity that I'm here in is as a member of the White House Coronavirus Task Force. The pandemic has posed a major challenge to our public health structure here in the United States, as in other countries. I think this is an excellent timing for the webinar, because we're at a stage where we're now having used a very blunt instrument, the lockdowns, to limit the initial impact of the pandemic. We're at the stage of adaptation and innovation to allow us to live with the virus until we have a way to eliminate its threat, such as a vaccine. And that adaptation and innovation will entail both behavioral and technical and structural changes to allow us to maximize the economic vitality of our societies, while at the same time limiting mortality and morbidity. So I'm very honored to participate, very glad to meet everyone electronically who's present on the webinar. And thank you very much. Over.
Thank you, Mitch and Chuck. And I know that people in the region will be eager to see you when you get to Tbilisi and can open the regional office that covers many of the countries represented, including Azerbaijan, which is the next place to speak. But before I go there, Efkan, did you want to address an issue about being able to share screens? Several of the presenters have said they don't think they're going to be able to share their screens, and you had said in the chat that you could reply to that, or could the IT person address that?
Ambassador, we are looking into that. Give us a second on this.
Fine, no problem. I think it was speakers later in the program, but we have Deputy Minister of Healthcare for Azerbaijan, Viktor Gasimov, and Zaur Aliyev, the Chairman of the Board of the State Agency for Mandatory Health Insurance. Minister Gasimov, are you going to be speaking on behalf of your government? You're both muted. Dr. Gasimov was head of the Sanitary Epidemiological Surveillance Department in the Ministry of Health and manager of the TB control program. We can hear you now.
Да, очень приятно. Мне очень приятно присутствовать сегодня на этой встрече. Эта встреча посвящена самой насущной проблеме, стоящей перед мировым сообществом. Это проблема коронавируса. Мир столкнулся с очень серьезной проблемой, которая стала проблемой не только здравоохранения, но имеет серьезные экономические и социальные последствия. Сегодня уже с уверенностью можно сказать, что это результаты повлияют на будущее развитие всех стран. С момента появления нового коронавируса, еще до объявления пандемии, в стране начались проводиться профилактические мероприятия. В стране был создан при Кабинете министров оперативный штаб, который был наделен широкими полномочиями и до сих пор ежедневно решает организационные вопросы. Как известно, в борьбе с настоящей коронавирусной инфекцией, от которой до сих пор нет вакцин и специфических препаратов для лечения, главной задачей всех стран было замедление развития этого заболевания и его широкого распространения. Вместе с тем, эта инфекция далеко не изучена, и страны набираются опытом буквально ежедневно в ходе практической работы. Поэтому обмен опытом является сегодня одним из важнейших направлений сотрудничества. Что касается Азербайджана, я хотел бы сказать, что в нашей стране меры по борьбе с коронавирусом были организованы и проводились в нескольких направлениях. Во-первых, были приняты меры для предотвращения проникновения вируса в страну из-за рубежа. На самом раннем этапе была организована проверка прибывающих всех граждан в страну, их тестирование. На следующем этапе закрытие границ, организация карантинных мероприятий для наших граждан. Для этого были выделены ряд медицинских учреждений, гостиниц и других учреждений, где была создана также медицинская помощь. Второе направление – это меры, принимаемые для предотвращения распространения инфекции в стране. Эти меры были реализованы поэтапно, в зависимости от ситуации. К ним относятся применение специального карантинного режима, организация широкомасштабной дезинфекции, перевод работы учреждений в дистанционный режим, расширение онлайн-услуг и так далее. И самое главное в этом направлении – это организация эпидемиологического надзора, когда каждый случай был расследован, устанавливались контакты и велось медицинское наблюдение. В настоящее время 5000 человек находятся на домашнем карантине. Следующее направление – это своевременное выявление инфицированных людей. Для этого как можно было быстро в страну были доставлены тесты. Расширена сеть лабораторий. Сейчас в стране 23 лаборатории занимаются тестированием. И по сегодняшний день проведено порядка 280 тысяч тестов. Это в пересчете на миллион населения 28 тысяч исследований. И, наконец, организация лечения больных. Для этого в Баку и в регионах были выделены специальные больницы. Следует отметить, что дополнительно были введены в эксплуатацию клиники, а также построены мобильные госпитали. Человеческие ресурсы тоже имеют большое значение. Сегодня практически со всей страны созданы квалифицированные медицинские работники, которые работают в этом направлении. Проводится их постоянное обучение, тренинги, в том числе онлайн-режиме. Во время пандемии азербайджанскими врачами тщательно изучаются рекомендации как Всемирной организации здравоохранения, так и CDC, а также организованы виртуальные общения со специалистами других стран. по различным вопросам ведения коронавирусной инфекции. В результате всех этих мер сегодня эпидемия коронавируса в стране практически полностью контролируется. За истекший период среди населения страны 10 миллионов населения зарегистрировано 4,5 тысячи инфицированных, 63% из них уже излечились, и число умерших составляет всего 52 человека. Дорогие друзья, COVID-19 – это новая инфекция для людей. Человечество сейчас знакомится с вирусом, изучает его. По словам первого вице-президента Азербайджана Мехрибан Алиевой, это парадоксально. Несмотря на обилие информации, вопросов больше, чем ответов. В такой ситуации опыт, знания и информация имеют особое значение. Я думаю, что главная цель сегодняшней встречи – это обменяться опытом о шагах, которые мы предприняли на национальном уровне, поддержать друг друга в случае необходимости и укрепить сотрудничество между нашими странами в чрезвычайных ситуациях. Я верю, что наши страны и народы смогут справиться с этой сложной ситуацией и победить в борьбе с коронавирусом. Спасибо.
Thank you very much, Minister Gasimov. And you almost kept to the 5 minutes. Thank you for, I hope speakers will keep time. Mr. Aliyev from the National Health Insurance of Azerbaijan, do you want to say just a word to supplement the minister?
Yes, thank you, Mr. Ambassador. I would like to just add a few words to my colleague, Mr. Viktor Gasimov. And before doing so, I would like to express my sincere gratitude to Caspian Policy Center for organizing this virtual conference to discuss COVID-19 in the region. COVID-19 has hit over 210 countries, affected more than 7 billion people, and claimed more than 350,000 precious lives. We desire the repose of the souls of those who died from the pandemic in our country and around the world. We express our condolences to their families and wish those infected a speedy recovery. Azerbaijan took prompt and necessary measures to prevent the spread of coronavirus. Following the government's executive order at the beginning of the year, operational headquarters was set up under the Cabinet of Ministers. As Mr. Gasimov has already spoke about it, so I will just keep it short. During the pandemic, the priority for us was to protect people's health and their social security. All public events have been postponed or cancelled since March. From 3rd of March, teaching at all educational institutions across the country gradually suspended. A special regime introduced on 14th of March, including a series of measures of social distancing, and on 24th of March, a special quarantine regime was introduced. And Mr. Gasimov has already mentioned, we have spared like 20 hospitals which has been allocated for the treatment of patients with coronavirus. We are planning to build and commission 10 modern modular type hospitals with 200 beds each to increase the hospital bed capacity. And we have laboratory tests, medical equipments and supplies, all has been purchased and delivered to Azerbaijan. On March 19th, Mr. President Ilham Aliyev signed the decree on measures to protect the public health in the Republic of Azerbaijan and strengthen the countermeasures against the coronavirus infection. The Coronavirus Response Fund was established under the decree. The purpose of the fund is to prevent the spread of the coronavirus infection in the Republic of Azerbaijan and provide financial assistance to the countermeasures. Currently, the amount of donations transferred into the fund exceeds 113 million manats, which is equivalent to around $67 million. Along with state funds, voluntary contributions into the fund from individuals, entrepreneurs, and organizations are of great symbolic importance. It's an example of solidarity in Azerbaijani society. Thus, because of all these measures, the mass infection was prevented. Now our concerns are growing about the second wave of infection. In case of a second wave of coronavirus in Azerbaijan, we have enough health system capacity. Preparedness of the healthcare system is more important than ever because no one knows how long coronavirus will spread. In Azerbaijan, all confirmed patients, even those without symptoms, are isolated in the hospitals. We have placed our most modern hospitals at the disposal of patients with the coronavirus. Having said that, national response to COVID-19 is not enough. We need to concentrate our efforts on the regional and global level to curb the spread of the coronavirus. We need to take secure steps in each critical areas as prevention, quarantine, detection, and treatment and contact tracing. We need to move as fast as we can to curb the global spread of the virus and do our best to stem cross-border transmission. In this challenging time for all of us, once again, we urge all states to maintain a friendship, mutual support, and solidarity. We express our thanks to everyone for cooperation, and I would like to thank again Caspian Policy Center for organizing this great video conference. Thank you very much, Mr. Ambassador.
Thanks very much. It's Georgia is next, and we have Tamar Gubunya, the first Deputy Minister for Internally Displaced Persons from Occupied Territories, Labor, Health, and Social Affairs. She is a longtime associate with USAID in Georgia and worked also for the United Nations Population Fund before joining the ministry. Minister Gubunya.
Hello, good afternoon, everyone. It's my privilege to speak today on this panel and share Georgian experience for COVID-19 response. Georgia is a small country with 3.7 million population, and up until now we managed to contain the spread of the epidemic, and as of today we have 735 cases reported, and with 547 recoveries and 12 deaths. As compared to other countries in the region, this is quite low, and Georgia appears like a green island in the region, and this was possible via very strict social distancing measures. The government decided to introduce restrictive measures as early as in February, because we've decided it's better now to go more proactive and prevent the spread of the epidemic rather than deal with increasing number of cases, which would be very difficult to manage without having effective drugs or knowing how to deal with such a high level of uncertainty. Georgia established a multi-sectoral committee because it was very clear from the very beginning that health sector alone could not handle this, and we had to be engaged all sectors, including Ministry of Interior, Ministry of External Affairs, and all other agencies, which really played a huge role in providing different interventions or in supporting different interventions and making the response truly multi-sectoral and really comprehensive. As for the healthcare side, of course, our major purpose was to make sure that healthcare facilities are well prepared and equipped to respond to COVID cases. Of course, the first major objective was to make sure that we have adequate testing capacity. And thanks to US government support, we have a well-functional Lugar Center in Georgia, which has a very good biosafety technologies in place, and the Lugar Center was able to quickly introduce PCR testing technologies for COVID-19, and since early February we could do testing for all incoming travelers who were found with fever at an entry point. Since then, we've rapidly scaled up testing capacity, and nowadays we have around 12 private labs engaged with testing, and our testing capacity daily it's up to 1,500 tests, and we intend to increase the testing capacity, almost double testing capacity by the end of June. Up until now, we've tested over 50,000 individuals with less than 2% positivity rate. Testing strategies were really well elaborated and targeted to high-risk individuals. And right now we continue mandatory testing for healthcare workers, as well as people in quarantine, because we still have 14 days mandatory quarantine for all incoming travelers, regardless of the country of origin, no matter is it a foreign citizen or Georgian citizen. Everyone coming to the country, they should undergo 2 weeks quarantine, and then we test them at 13th day. It's very important to have healthcare facilities well prepared, and we do appreciate assistance provided by US CDC, World Health Organization, and other international partners in training epidemiologists. And our epidemiologists, they had field epidemiologist training program far before the COVID epidemic, so they were well prepared for field activities, and it was very helpful to have them on board immediately with the COVID response. As for the health facilities, of course, the government decided to cover all costs related to COVID, was that testing or inpatient care, and hospitals were mobilized, and we now have 29 designated COVID hospitals, and then 15 fever centers at each district level to make sure that we avoid nosocomial transmission of disease, and we have a more active control of patients' flow. The good news is that those hospitals are now empty, and we only have less than 12% of utilization rate for those hospitals. They are kind of in a standby regimen, and if we need them, we can activate those hospitals really easily. On May 22nd, the government canceled the state of emergency, and now we are lifting all restrictions that were in place, and the post-crisis plan actually defined a very specific interventions and steps how to lift and what should be timeline for lifting restrictions without going back or getting another wave of the epidemic. Nowadays, our major challenge is again to establish safe procedures for incoming travelers, and you may know that Georgia is a was a very attractive touristic destination before COVID, and of course we want to again reactivate like touristic activities in the country, and now we are discussing what would be the best and most appropriate measures for letting people in safely without bringing like risk to the community. Of course, there is communication to the public, and public engagement was our major objective, and I think it's really important that people now understand COVID-related risks, and they started to adopt protective behaviors, which is very important in the long run, and we will continue working on that. I would stop here. Yes, I would stop here, and I would like to mention that we can't wait for establishing the CDC local office, the CDC regional office in Georgia, and we are really honored to have this opportunity. And of course, Ministry looks forward to this cooperation within the country and in the region. Thank you.
Thank you, and thanks for the comprehensive report. Representing Kazakhstan, the Deputy Minister is unable to join us, but Saule Kasimova, the Acting Director of the Department of Strategy and International Cooperation, is on the line, and welcome. I'm sorry I don't have your biography, but you'll introduce yourself and speak for 5 minutes, please.
Yes, thank you very much. Can you hear me? Honorable participants of the conference, it is my great pleasure to greet you all today and to address you at the Caspian Policy Center online conference on the global response on COVID. Today, the fight against COVID-19 pandemic and elimination its negative consequences on the agenda of many countries. Unfortunately, coronavirus caused not only enormous economic damages around the world, but also caused irreparable loss of human lives. We express our sincere condolences to all who lost their lives, and during this pandemic. Kazakhstan continues to take critical measures to prevent the spread of coronavirus infection and restore economic stability in the country. Due to timely restrictive and sanitary epidemiological measures in the country, the intensity of the spread of coronavirus in Kazakhstan is significantly reduced. However, the country continues to implement quarantine measures in all regions with their gradual mitigation depending on the epidemiological situation. On April 13, the country began an active prevention examination of vulnerable groups, workers of critical public services such as doctors, police, etc. In addition, from May 11, we switched to sentinel epidemiological surveillance of coronavirus infection, that is random testing among various population groups, which will allow us to have a holistic picture on the prevalence of infection in the country. Overall, it should be noted that the country has established timely diagnosis and treatment of patients with COVID-19. Bed capacity, supply medicines, personal protective equipment are adequately provided. In order to strengthen the system of sanitary and epidemiological services in Kazakhstan, the status and authority of chief and territorial sanitary doctors in the country were expanded and radical reforms were carried out in the structure of the service. We're also taking actions to robust the health system for the possible second wave of COVID-19 by integrating primary healthcare in the overall public health response to COVID-19. The role of PHC is crucial in informing patients and community about COVID-19, interrupting the chain of transmission, identifying vulnerable population groups, as well as ensuring appropriate referral to testing, home isolation, and hospital admission. The other important issue is a broader use of digital technology and development of digital health ecosystem, which provide us new possibility during the challenging time of COVID-19. Digitalization of public health services, laboratories, and PHC has been played an important role in Kazakhstan response to take timely and right action. In addition, the Ministry of Healthcare continuously conducts trainings and consultation meetings with international epidemiology experts, such as experts from Israel, China, Korea, Japan, etc. Most of all, it's necessary to strengthen interaction in the area of operational information exchange, conducting preventative anti-epidemic measures, developing innovative approaches to diagnosis treatment, strengthening scientific cooperation between countries, and developing vaccines, ensuring their accessibility to the entire population. In this regards, we would like to know the assistance provided by the regional mission of U.S. Agency for International Development in Central Asia and the regional office of U.S. CDC in form of advisory, methodological, financial support to Kazakhstan in the fight of COVID-19. We believe that through the joint efforts and accumulated experience and knowledge, we will still be able to strengthen the health care system in counter future potential outbreaks of infection diseases, as well as to improve mechanism for health protection. Thank you very much.
Thank you, and thank you for keeping time and for filling in the last minute for your Deputy Minister. We do now have from Turkey, Emin Alpmese, who's the Deputy Minister of Health, has a long academic career as a microbiologist, and we're eager to hear from Turkey. Thank you very much.
Thank you very much, esteemed participants. Good morning and good afternoon. First of all, I would like to thank Director Afgan Nifty for organizing this very important meeting. I believe our discussions today will contribute our knowledge on COVID-19 and protection of public health. First of all, I would like to share the latest data of Turkey on COVID-19. As of 26th May, the total case number in Turkey is 158,000 patients. And I believe that we have a good ratio at this point, that we have totally recovered cases of 121,000 patients. Unfortunately, we lost 4,397 patients among these cases. Very low death rates of COVID-19 in Turkey compared to the world gives us consolation. Lately, there is a decreasing trend in case numbers in Turkey. We act with the principle of testing maximum number of people, testing right persons at the right time. And we have implemented timely and effective preventive measures. The entry of virus into Turkey was delayed for 3 months with comprehensive measures. This extra time was used to complete all necessary preparations. After the arrival of the virus, we have taken measures such as lockdown in a timely manner. This helped us to limit the spread and disrupt transmission chains. We treated cases with early and efficient treatments. This resulted in very low mortality in Turkey. We have a declining trend in the number of new reported cases. This is a very crucial period. We know that many countries are also reporting decreasing trends. So this time period is not only important for Turkey, but also for all of us. Strong global and regional leadership and guidance during the transition period is important. Collaboration, info and knowledge sharing through platforms like this are also very important in this period, as in all phases of a pandemic. Because potential mistakes can waste all our efforts and success so far. As Turkey, we initiated the normalization process in a whole of government and whole of society approach with the leadership of President Erdogan. We considered the recommendations of our scientific board and take WHO's global technical guidance into consideration. Within this scope, Turkey has prepared a normalization plan. We aim to normalize our citizens' life as best as we can do during outbreak. We hope to succeed by falling neither to pessimism nor to slackness. Our normalization plan covers loosening the measures gradually in May, June, and July. This does not mean that we remove some of our measures. Instead, we will adjust our policies to the declining trend by also considering local differences. We will keep applying measures everywhere, such as physical distancing and wearing masks at all times in public places. We are all aware of how depressed and stressful some people are, particularly elderly and children. Therefore, one of our first steps in transition period was to adjust lockdown measures depending on the age groups. We allowed them to go out at a designated time period by avoiding peak hours and busy days. We have limited entry into and exit from some cities for more than a month. Considering that we have decreased case numbers to a very low degree in some of them, we removed entry and exit limitations of some cities a few weeks ago. However, in order to avoid community transmission, all cities were locked down during the 8th. In addition, some essential businesses were opened a few weeks ago to ease our citizens' daily life. However, they have to follow certain hygiene rules and customer number limitations. This pandemic put not only health systems, but also international supply chain into test in terms of preparedness and resiliency. As Turkey, we support undisrupted flow of international supply as well. In this regard, Turkey showed her support to more than 80 countries and some international organizations with provision of diagnostics, PPEs, and grants, and by issuing a special import-export permission to 65 countries. In addition to that, needs of many countries are met through a corporation affiliated to the Ministry of Health, International Health Services. We have put measures to facilitate international trade as well. We aim to contribute to international supply of essential food, medicines, and personal protective equipment. We started to admit foreign patients for treatment in Turkey. We plan to begin international flights to some countries depending on risk agreement. Our normalization plan will be a dynamic process. Depending on up-to-date developments, some measures may be loosened earlier or later. Future of normalization will be decided by not only results of our measures, but also public behavior. Therefore,
okay, time please to wrap up.
Thank you very much. That's why we keep informing our public on a daily basis, and these are my last words. Thank you very much.
Thank you, and I'm always understand the protocol of interrupting ministers, but I appreciate very much that people are keeping the time so we have time for questions. And I know our interpreter, who's now at 1 hour of interpreting, that's a very tough job. So thank you for your energy and keeping at it. We have one more presentation, and that's from Uzbekistan, Bahodir Yusupaliev, who is the First Deputy Minister of Health and Director of the Agency for Sanitary and Epidemiological Well-Being. And he's been in the social sector for health and social protection and many jobs in government prior to becoming Deputy Minister. So, Mr. Yusupaliev, if you can unmute. Thank you.
Здравствуйте, уважаемые коллеги. Рад вас приветствовать на сегодняшнем мероприятии, посвященном обсуждению политик государств в борьбе с коронавирусной инфекцией. Действительно, все страны мира с начала текущего года столкнулись с этой инфекцией, и несмотря на принимаемые жесткие меры, мы сегодня должны все равно констатировать тот факт, что ситуация еще остается напряженной, и мы должны, естественно, совместными усилиями бороться с этой инфекцией. И пандемия показала, что сегодня, на сегодняшний день, инфекционные болезни все-таки еще остаются серьезной проблемой и угрозой современному миру, и работу в борьбе с именно инфекционными заболеваниями все страны мира, я так полагаю, должны проводить интенсивно и совместно работать. Сейчас были выслушаны доклады из других стран, и можно сделать вывод о том, что в принципе все страны, они проводили те мероприятия по борьбе с коронавирусной инфекцией, которые в принципе были определены документами Всемирной организации здравоохранения, что позволило принять своевременные действенные меры. Это и заранее принимаемые меры, и создание специальной комиссии в каждой из стран. Это межсекторальное, обязательно межсекторальное взаимодействие. Это принятие жестких карантинных мер, скажем так, в начале распространения инфекции. Это меры принимаем по отношению к больным, их госпитализация или лечение на дому. Это тестирование больных, это подготовка коечного фонда, кадровый потенциал, соответствующее медицинское оборудование, а также медикаменты. В Республике Узбекистан первая инфекция, значит, больной был зарегистрирован 15 марта текущего года, и на сегодняшний день у нас количество больных составляет 3355 человек. На сегодняшний день выздоровело из них 80% выздоровевших, и 20% пациентов находятся на лечении. Показатель смертности в республике у нас составляет 0,4%. В настоящее время, кроме того, значит, находятся под наблюдением на домашнем карантине у нас порядка 25 тысяч граждан, и где-то 20 тысяч граждан находятся на стационарном карантине. Необходимо отметить, что все больные в Республике Узбекистан, независимо от тяжести заболевания, они также госпитализируются, то есть в стационарных условиях лечатся. И это нам пока мы можем себе это позволить. потому как количество больных не так много. Кроме того, мы, значит, первый ряд контактных лиц с больными обязательно тоже госпитализируем специально, изолируем специально отведенные карантинные зоны, где они также изолируются. Второй ряд контактных и последующие, они находятся в домашних условиях в режиме самоизоляции. Значит, с первых дней были приняты жесткие карантинные меры, так же, как и в других странах, работает специальная комиссия на уровне правительства, организованная руководителем страны, а также, значит, все необходимые министерства, ведомства, это и Министерство внутренних дел, это и Национальная гвардия, это и таможенный комитет, то есть практически все министерства, ведомства вовлечены в этот процесс. И это очень важно, что есть межсекторальное взаимодействие в каждой из вышеперечисленных стран, это уже было озвучено. Необходимо отметить, что за период вот этой вот коронавирусной инфекции в республике, значит, введены в строй 4 больницы на более чем 2600 коек, организована отдельная карантинная зона для контактных лиц на 20 тысяч человек, где могут поселиться. Значит, усиленные карантинные меры, как и в других странах, сегодня у нас также ослабевают в стране. То есть, естественно, любая страна думает о, значит, развитии своей экономики, поэтому у нас также эти меры постепенно, поэтапно, значит, ослабевают, снимается карантин. Но сегодня у нас в страну возвращается много людей, которые находятся за рубежом, и вновь выявленные случаи, где-то порядка 50-70% приходится именно на ту категорию граждан, которые возвращаются из-за рубежа. Значит, но те карантинные меры, которые сегодня у нас существуют, это обязательно, мы это и не сняли, еще не предполагаем снять. Значит, поддержание социальной дистанции, ношение масок, запрет на деятельность учебных заведений, развлекательных учреждений, проведение всевозможных публичных мероприятий, а также движение общественного транспорта. Ну, за период пандемии разработаны соответствующие руководства Минздрава, основанные на рекомендациях руководства Всемирной организации здравоохранения, а также временные санитарные нормы и правила, которыми руководствуются те сферы деятельности, которым уже сегодня разрешено функционировать и которые уже работают. Значит, немаловажное значение имеет, так скажем, сотрудничество между странами, поэтому на регулярной основе у нас в стране проводятся видеоконференции, это и с Китаем, и с Кореей, с Японией, Соединенными Штатами, Германией, Израилем, то есть практически очень много видеоконференций и консультации осуществляются в режиме онлайн. А также, кроме того, к нам были приглашены специалисты из других стран, из той же Кореи, из того же Китая, Германии, которые также вместе с нашими местными коллегами проводили работу по борьбе с коронавирусной инфекцией. Значит, но на сегодняшнем этапе это та информация, которую я хотел вам предложить, и поэтому я хочу поблагодарить, значит, всех организаторов сегодняшнего совещания с тем, что они приложили усилия для проведения ее. И я думаю, вот такое взаимодействие, оно обязательно даст свой результат. Спасибо.
Very good, and it's you have the most impressive backdrop for your presentation. I see you're working and that people are wearing masks, so that's a good message. That does conclude our presentations, and we had a couple of questions that were submitted online, but I'm going to take the moderator's prerogative of asking the first one. And that is thank you for very comprehensive reviews of the situation in each country. And it's clear that everyone is taking extraordinary action to meet the unusual challenge of COVID-19 and the SARS-2 coronavirus. And I think in all cases, as would be expected from this region, that your workforce and facilities, those things that are under the direct responsibilities of many of your ministries of health, seem to be adequate to the task. But some of you, it's very hard to admit when there are challenges or where there might be things that aren't being done to the optimum way. And I'd be interested if any of the representatives, ministers, or representatives from the countries can talk about if there are obstacles that still exist to your scale up of response. And that could be on supplies, tests, personal protective equipment, ventilators, or are you, although you've talked about international cooperation, is there technical guidance in this changing epidemic that that you still would benefit from in terms of medical guidance or on reopening or on economic resilience in the face of the epidemic. Are there any ministers that have a comment on remaining obstacles, and especially while our CDC colleagues are here, things that in particular the US or the World Health Organization might be responding to? Mr. Gabuni, I saw you leaning forward. Can I put you on the spot to say, are there obstacles to the response?
Sure. I would like to talk about the healthcare workforce a little bit. When we've started the whole process, like about preparedness of this health sector, we were really very anxious about having enough ventilators in place or having adequate number of resuscitation beds. But eventually we found ourselves in shortage, not in relation to equipment, but in relation to healthcare workers. Because it happens that in Georgia, we've developed a lot of healthcare facilities and hospitals. There are many small-sized hospitals, and people are used to work in different places. And for the sake of infection control, we've just introduced a regulation to prevent people from working in different positions. If they work in COVID clinics, then they should work for COVID clinics only. And of course, we found ourselves in somehow shortage of healthcare workers, and this is something we need to reconsider in the medium to long-term perspective, because by bringing equipment in hospitals would not solve this problem if we do not have adequate human resources in place. As for the testing capacity, of course, it's another challenge, and we all know that it's important to have adequate supplies in place, but at the same time, what we really found very challenging is to elaborate well-targeted testing strategies, because we do not know much about efficiency of testing interventions, which groups would be more appropriate to cover, and where we can yield highest possible outcomes. So we are experimenting a little bit nowadays, and it would be good to have more evidence-based for designing our testing strategies to make sure that we have adequate use of already limited resources, not only at a country level, but also globally. And one last point I would like to mention, it's a high infectious rate among healthcare workers. In Georgia, it was 13%, and well, we know it was higher in other countries, but here it's not only about having access to personal protective equipment, it's about having healthcare workers disciplined and prepared to correctly use PPE. So again, this is something we need to take into consideration and give proper attention to infection control measures in hospital. Over. Thank you.
Thanks. Are there any others from health ministries who have a comment, or Dr. Vitek or others, did you want to respond to the question about testing protocols? I think we have the same question in the US, that there are a number of tests and we're not sure exactly what the national standard should be or how to interpret the results. Maybe I'm misinterpreting. I think you're on mute.
Yeah, it's very true. Actually, we had this consultation with US CDC colleagues, and yeah, it's like we all understand how the tests work, but still we all are waiting for improving the quality of like rapid tests, and we look forward for new technologies. But whatever we have nowadays, it's important to have the best use of whatever is available in terms of supplies and technology. So any ideas on that, of course, would be helpful for the countries to plan their response, to better plan their response.
Chuck, Mitch, or Dan, do you want to respond? Otherwise, I have more questions.
Yeah, I don't think that there's it's an easy to sort of respond in detail. I think that, we are, even at the individual state and local level, we're facing this issue in the United States where there are a mix of tests that are available, and the optimal usage really depends a lot on local characteristics. With some testing organizations tailoring which tests they use to the specifics of the individual patient presenting, so that one group of patients gets one type of test. So I think it would take a detailed response and sort of thinking through of the strategy, which I think that our ongoing collaboration in that direction would be useful.
But am I right that the test doesn't depend on the clade of the virus or some kind of mutation of the virus itself? It's just a question of the specificity and the reliability of some of these tests which have been developed relatively quickly.
That's correct. Yeah, it's not a question of, so far there's no evidence that any of the viral mutations have any impact on it.
Very good. We had a more specific question for Central Asia and Dan Singer. You talked about a $6.8 million commitment of the US, and the question was to go into a little more detail of that, including is Turkmenistan eligible or just the 4 countries where CDC has a presence?
Thank you. I just typed an answer to that question. We did not include Turkmenistan within that 6.8. That's the one country in this area where we don't have an office. We did make an offer to the government at the beginning of the epidemic for assistance, and received a very polite reply that they were working closely with WHO and that there was nothing they specifically needed from the US at that time. So we are actually in touch with the WHO office and our embassy in Ashgabat. I had a call with them earlier today, and we remain open to any collaboration with Turkmenistan, but we have nothing going on right now actively. The 6.8 million is allocated to the other 4 countries within Central Asia, and each of those is getting a slightly different amount with slightly different focus, but all of them are getting investments in laboratory capacity, border health capacity, epidemiologic surveillance, those types of things. And some are also getting investments in creation of an emergency operations center.
Great, thanks very much. Question from Ambassador Sakuta. None of you mentioned preparations for a second wave. Is this part of your thinking? And do you see this coming? And do you think that your countries will be adequately prepared for that if it does? Any of the health ministers, deputy ministers, want to take that one on?
May I have?
Yes, please, Minister Messe.
Yes, so now we are also preparing our plans for the second wave with our scientific boards, especially for test capacity and supplying all the PPEs for our healthcare workers, also for the public places. And also we are aware of influenza during this time, and we are now supplying, we are offering vaccines for the second wave during the influenza season. And also we know that physical distancing and mask using in the public is very important during this time, and also for chronic diseases. And we are preparing our plans for second wave, especially supplying these things.
Thank you, and I misspoke in that Ms. Kasimova did talk about a second wave, so she was ahead of them and prompted the question, but thank you for your good answer, Mr. Messe. Also, you mentioned vaccines, but I'm sure you're talking about influenza vaccines, but there's an important question that if a vaccine is available at some point, are the countries in this region worried about access to it? These vaccines are being developed in the US and China and many places, but as far as I know, not in your region. Are you doing consultations with WHO or with this consortium led by the European Commission and the UK that are talking about vaccine access? And do you see this as a potential major problem? I have to say that as a health policy person, I see it as an enormous challenge to the global health community because we really don't have a governance system that will necessarily answer the question. Once a vaccine is available, are you worried about access to it for your population?
Yes, also we are worried about this, supplying the vaccines for coronavirus. And also we have some research and development programs about coronavirus in Turkey. And also we have some collaboration with the countries in our region, like Russia also. And also now we are working on this, but we have also, you are right, we are worried about access to vaccine, coronavirus vaccine in this region.
Are any of the other panelists have a thought about that topic, about access to vaccine? If not, a question for Mr. Aliyev. We know that Azerbaijan introduced mandatory health insurance just before the pandemic. How is this working, both in terms of practical access and economics?
Thank you for the question. It's just, unfortunately, we had to postpone the mandatory health insurance in Azerbaijan till 2021 because it was the first year that we were planning to implement health insurance, but because of this coronavirus, we were not able to transform the hospitals. As you know, our current system is an inheritance from the Soviet Union, which is finance based on the, which is input based finance in Azerbaijan, but we were planning to change it to the output based. So as we started and we were planning to implement it gradually, we divided Azerbaijan into 4 regions, which were like in each quarter we were planning to implement the health insurance in each quarter, like in 20 regions approximately. And we started the first 20 regions, but we couldn't carry on forward, so we postponed it to 2021, 1st of January. So hopefully by that time we will be able to carry on with our job.
Thank you. There was one question emailed before the session started from Dr. Mohammed Kayume in Afghanistan about the roadmap to normalcy and ways to restart the economy. Realize this isn't the exclusive domain of the health professionals here, but are there countries that have a plan? And if so, how do these relate to the economic damage that's been done by the coronavirus? Is there anyone who has a thought about the roadmap to recovery?
May I comment on that?
Yes, please, Minister Gubunia.
Georgia developed a post-crisis plan for each sector, and of course it entails activities to stimulate economy after the COVID-related consequences. So it happens that we had a very long, like almost 8 weeks lockdown, which had a severe impact on business sector, and of course it had social consequences. And we've developed a post-crisis plan which entails interventions for social support, because it was very necessary to provide some compensation or social aid, like monetary aid, to vulnerable groups and people who found themselves without employment during this crisis. And the post-crisis plan also entails innovative approaches to remodeling service delivery to make sure that we go more using more technologies. We go with this distance communication, online learning, and at the same time we've introduced protective mechanism for businesses to have specific regulations implemented, and our labor inspectorate now does more supportive supervision rather than punitive like observations and inspections to help them to introduce protective measures and to learn how to do their business with COVID. And nowadays we're working for developing a specific post-crisis plan for health sector, because now we are talking about this second wave. Third wave could come and could be followed by other waves, other emergencies. So I think it's very important now to rethink about resilience of our system and to be more serious about developing post-crisis plans specifically for health sector. Over.
Thanks so much. And we have reached the time when I'm going to ask Afghan Nifty to summarize. Fantastic presentations. Everyone was very well prepared, and it's clear that every country is taking this threat seriously and is mobilizing resources and working with international partners. Ambassador Hoagland had a final question about what the region itself is doing cooperatively, but in the interest of time, I'm going to turn over back to our host and the Caspian Policy Center to sum up. But thank you everyone for participating. Very high quality of dialogue.
Thank you, moderator, and thank you, Ambassador Coker. This was a good moderation as well, and I want to thank you first. And I'd like to thank all the embassies who helped us to put this together. I especially thank to our speakers from the region, all the deputy ministers, and hopefully we can continue this dialogue down the road. This is the first event of our Caspian Policy Center on this issue, and we hope to continue doing this event, this kind of events on different other topics. But I believe that to start the dialogue was important, and I highly value especially also regional cooperation in terms of, as the Ambassador Hoagland posed a question, maybe perhaps a little comment on this. And we have seen countries trying to help each other and also try to keep the supply chains active and uninterrupted. I believe that close cooperation between the countries will help the situation mitigated in a good manner. Once again, I appreciate everybody's attendance to this, and if any questions, please don't hesitate to contact us. And I appreciate our attendees' attention to this event. We had tens of attendees from the region and the United States. We hope to continue providing this platform for all our partners in the region, and hopefully we can keep the dialogue going. The video of the event will be available on our website, and if anybody missed this event, they can go back and check it out again. Again, thanks everyone. Thanks for joining this call. And also I want to especially thank our colleagues at the CPC for helping us, our staff, to put this together. And we will stay tuned to hearing back from you, or any feedback you have, please don't hesitate to contact us. Thank you.
Thanks, everyone. Thanks.
Thank you.
And thanks for the
Thank you very much.
CDC. Thanks for the
CDC,
people from
especially
CDC for joining, yes.
Yeah, yes. I especially want to thank the CDC as well. They had 3 representatives, and hopefully we can continue our collaboration with them in the future.
Thank you.
Thank you very much.
Thank
Yeah,
you
we're
all.
very happy to attend and continue collaborations. Thank you.
Thanks. Bye-bye.
Thank you very much.